Today we address what I call the fossil health dilemma. How can we decrease the oil dependence and the carbon footprint in the health sector? I'm joined again by the two physicians Staffan Mårild and Ellinor Berg. Join us for an inspiring conversation. This is the Evolution Show. Welcome to the Evolution Show. I'm your host Johan Landgren. The Evolution Show is all about connecting the dots to see the bigger picture and address some of the biggest challenges and opportunities of our time. In the previous episode, we talked about the climate crisis and how it relates to the health sector. And I talked to two people from the medical profession. And we talked about obesity, malnutrition, and a recent report from the Lancet that looks at how we can look at this big picture when it comes to climate change, obesity, and the general health in the health sector, and how we have to address it as one thing. And today we continue on that theme, but we talk more about the health sector in general and how it's affected about the oil dependence and its carbon footprint in general, and how we can address that. So I welcome you back, both of you, Staffan Mårild and Ellinor Berg.
Thank you.
So today would like to talk about what I call the fossil health dilemma. That's kind of the theme of today. And what I mean by that is, if you look at the health sector, it's very fossil dependent, like most sectors. But just as an example, if you look at United States, for example, 7.6% the general emissions on the planet, 7.6% of the emissions, they come from the health sector, which is basically more than Brazil as a carbon emitter. So it's huge. And United States is the country in the world that per capita has most emissions or most oil use from that sector. So I would like to address that. And also, just a correction, the health sector in general is 4.4% in general, the carbon emission, and 7.6% is the US. So now I've corrected that. But if you look at the health sector, and we think about doctors, medical doctors, we think about transport and so on, it all involves oil in different degrees. I wrote an article 9 years ago about this, and then I talked a lot about the transports and also all the kind of medical instruments you use. So have you thought about this as medical doctors, what you're using on a daily basis? Have you thought about the resource use and the carbon emissions, or what's your thought about that from your perspective?
Well, I think the health sector, there are many aspects. One is, of course, transportation, as you say. It's also when you operate people, you use bandages and cloths of different things. You have to sterilize and use equipment for surgery. You have drugs, and production of drugs also takes energy. So there are many things. You also have to look at how, I think that is also important, how many visits do you have per patient, because the patients go to the doctor by some kind of often fossil fuel transportation, and so I think there are many aspects of the health sector. If you tell the patient that they should come once a week to check something, instead of telling them that they can do it at home, that's a difference. So I think there are many aspects of what is happening inside the healthcare.
Yeah.
Yes, absolutely. There's been a very good development in healthcare. For example, we have less infections due to hospital care, but I think many of these developments, they haven't really focused on the sustainability in the development, and we really need to focus on that as well.
Yeah.
Better health and less infections is great, but we need to have the sustainability in mind.
Yeah, and just to follow up on that, I mean, the more energy we use, the more welfare we have, and it's kind of the same thing if you look at the health sector. The more energy we use, the countries with higher energy consumption also have a higher rate of health. So that's what I mean with the dilemma. Is it a dilemma, and can we kind of that's what I want to address today. Can we make a transition that we move away from the fossil fuels but still have this kind of high health standard we have? What do you think? Is this kind of... I can take more examples, but have you thought about this? That, yeah.
Yes. One thing is actually how the society, how equal people have in economy and in education and things like that. And there's a relation between inequality in income and health. So in countries like the States, where there are huge gaps in income, you also can see that obesity is much higher percentage in the population than in countries like Norway, Sweden, where income differences are not as high. So I think it's actually the income and the population equality that affects also the health, and I think that's an important aspect. I would like to mention the for example, the budget for healthcare in the United States is one of the largest in the world. I think it's 10-15% of the GDP, and still the public health is not very good in the States. I think it has to do with some people don't have any health care at all in the States, and some people have too much actually, and that will also give emission.
Yeah, and one of the aspects of the the carbon footprint of healthcare is also that the most effective way to reduce our carbon footprint would be for people not becoming ill at all. So I think we have to focus more on preventive care than we have in the past.
Yeah, that's a really good point. Just an example, I thought, when you talk about transports, there was a recent news that Amazon, huge company, they have ordered 100,000 full electric trucks, or smaller light trucks, if you call it, from a new company called Rivian. And that's kind of interesting if you think about the health sector. It must be a huge transport fleet that you use all the time in different degrees. It's not only ambulances and so on, medical emergency vehicles, but it's a lot of transport going to to the hospitals with equipment all the time for the medical equipment and drugs for the patients and for your doctors and so on. So that could be perhaps a way to at least in a kind of quite fast way, based on if we can have electric transports, if you can have kind of a pressure or demand from your sector to change that, we want electric fleets for we need that. That's I think one step at least we could do in a quite short time. Plastic one-time items, I guess you use a lot, plastic gloves and things like that. You use them one time and you have to throw them away. They have to be sterilized equipment and things like that. It might not be doable at this moment to substitute them. I don't know. Have you thought about things that you could perhaps change in your equipment? Have you? It's perhaps not something you think about on a daily basis, but have you? Yeah, what do you think?
Well, I think there have been progress in that field in mainly in England, in the National Health Service. They have had a system where they have worked with this kind of problem for I think 10 years or something like that, and have really looked at things like surgery. What equipment do you need, and how much can you change to other kind of equipment, and they have really made great progress. They have reduced the emission, I think about 20% or something like that. By having and they have spread this system all over the national health care system. And on the same time, the productivity in the healthcare increased when they did this. So it was a double effect. Yeah. So and there has been project also in Västra Götaland and in Skåne where they have tried to do similar things to change how operations mainly. So there are many things to do actually to reduce the footprint.
Yeah, for example, bioplastics instead of plastics, we use a lot of gloves and these kind of things, and reusable equipment whenever possible, and maybe more home visits, for example, and then maybe you can even go by bike instead of car. So maybe we don't even need electricity, but that's of course a really great compliment.
Yeah, and it's a good exercise for you as well.
Exactly.
So
double duty.
Ellinor and we discussed this out of the box outside that district nurses could they have a lot of cars and they go perhaps only 500 meters or some kilometers, and sometimes they have done this in other countries, in Denmark I think, having a bicycle instead. It might be possible.
When I think about hospital, my first thought was like, okay, what can you do, and what's kind of the low-hanging fruit? But then I thought about transports, but I also thought about the biggest hospital in Sweden. We have Karolinska Institutet, and I haven't seen this with my own eyes, but I've heard that they have in the tunnels between different buildings and so on, they use kind of electrified vehicles and so on. Some are semi-autonomous or even autonomous, 100% autonomous, going with equipment and things like that. So that's something you could do. So then I think maybe at a bigger scale you could also have this kind of between hospitals, between the manufacturer or the storage units you have where all this kind of equipment is stored, which can be far away. So that's perhaps something that could be developed further at more hospitals than just the biggest one. And I don't know how it is. I went to Uppsala Hospital with my brother some time ago, and then I saw these kind of small mini vehicles people were using to transport stuff inside. So at least that's something. But do you have other areas of the health sector you think you haven't mentioned here that you could work with to decrease the carbon footprint?
As I said, I think you can look at the healthcare isolated, but also the healthcare in the society. And how it's organized is quite important. A son of mine had a baby born in the States, and he had an insurance. And I realized that with this newborn baby, they made a lot of visits to doctors all over where he was born. And these doctors made exactly the same thing that the barnavårdscentralen, the child health care unit, the nurses do in Sweden. So it's and that will also affect the carbon emission, how you organize your healthcare.
Yeah, and that's a good point. I mean, to mention another country like US, because they have a huge carbon emission footprint from their health sector, but it's also because they have a very energy inefficient kind of approach to the whole health sector. It's huge in itself, but they're using fossil energy in all kinds of ways. You have the manufacturing of the drugs at huge facilities that might be, not even in the US, it might be in another part of the planet, and they're shipping in all the drugs, and then they're distributed with sometimes by train, but in US actually trains they run on diesel, so that's not so good, and so on and so on. So that's in US you have I think you can do small things and it would have a huge impact. But I think the biggest question we have to ask is in the world where they haven't even come close to our standard, but the population is growing, like India, for example. How can we address that? That's a huge opportunity, but also a huge challenge. Do you have any ideas about that? They are, of course, they work also differently, I think, as doctors a little bit there. They have other ways to work and so on, but
they have a different spectrum of diseases and problems, I think. But again, I think infrastructure is, of course, one important thing, that the society it's possible to communicate and also to organize the healthcare in a way that it's efficient. And I think in many cases the kind of disease problems they have, I think public health interventions are quite important. It's important also in the Western world, but even more perhaps in those countries.
Absolutely.
Yes.
The Lancet report that we talked about in the last episode, it had information that only 2% of the development aid for low and middle income countries go to addressing these non-communicable diseases, while the non-communicable diseases such as diabetes and heart disease, they are related to 2/3 of the deaths in these countries. So we can use more strategic funding and really, increase both health, but also maybe the fossil fuel need increase.
Yeah, totally agree. And I think that's a super good point, because Sweden is a small country, and people sometimes say that, we're such a small country, why should we take big steps and things like that? It doesn't have a big effect on the world. But that's a very weird way to look at it, because if you look at India and so on, and other countries like that, they have to jump across kind of, if they have to skip the fossil journey we have done already, because if they don't, we're screwed. So what we could do as example, Sweden as a small country, we are a country of innovators. I mean, outside Silicon Valley now, they're talking about that Sweden is perhaps the biggest innovator along with Israel per capita when it comes to innovations. So yes, we have a huge impact if we think about if we can introduce technologies that can, and also of course lifestyles, it's not only technologies, but and show that this is possible. And we can export that kind of technology and knowledge that can have a huge impact, I think. So as you mentioned, I mean, they're doing progress there in India and so on, but that's kind of perhaps where we should start. So kind of my last question, if we look at this report, what should we bring from the Lancet report, do you think, when it is there any conclusions from that one that we can relate to the carbon emissions that we talked about today as a kind of a last point here that you want to leave the audience with from the report?
I think the main message is actually that we have to change our food and what we eat, and we have to in connection to that also change agriculture, and if we change the way we produce the food and the way we eat it, we will have less emissions and we will have better health in the global perspective. And also for transportation, it's the same thing. We have to change the way we transport, not use fossil transports. And also, I don't think electricity is the only solution. I think we should also move with our legs and walk and take bicycles and things like that, because that's healthy. So that's what I think.
Yeah, absolutely. And I think we have to widen our perspective of the way we look at the economy today. We have to introduce health, public health and global health and environmental health in the economy, and we have to change the systems that we see development. It's really a key message.
Thank you both for coming. I think it was interesting, really interesting, and I encourage people that are Swedish audience to read the newspaper and the article. I'll put a link in the description, and also, of course, the Lancet report if you want to see the full thing, where you took most of your ideas. You were inspired by those ideas. So again, thank you.
Thank you.
Okay, thank you.
If you were inspired as well, feel free to continue the conversation in the comments below. In the previous episode, we talked about more in the kind of a general picture about the health sector and the climate, how we can address it, and why we need to look at obesity and malnutrition, and this report by the Lancet Commission. And in the next episode, we'll continue on a similar theme, but we are going to talk with the CEO and founder of Einride, one of the world's actually most talked about startups right now. They're developing a new self-driving electric truck that doesn't even have a cabin. And the CEO and founder, Robert Falk, is coming to the studio. That's going to be really interesting as well. As always, if you want to give us feedback, we appreciate it. Was it good or bad? If you want to see the videos as soon as they come out, consider subscribing. I hope to see you in the next episode.